Osteoporosis. This is a reduction in the bone mass, and unfortunately, in my experience, it's common but not commonly treated or diagnosed. So what does your typical osteoporotic patient look like? Well, usually it's going to be a Caucasian woman who's thin and over 65 years of age, and she's likely going to be postmenopausal. So as far as history goes, it's not something you usually get a history for. Like I said, you want to screen for this. And the United States Preventative Task Force actually states that they recommend screening for osteoporosis in women over age 65. It's a DEXA scan you order. Interestingly, they don't recommend screening men. But if the patient is going to give you any history at all, it may be back pain, because osteoporosis is associated with vertebral crush injuries. On physical exam, well, whenever you're examining an older Caucasian woman who is thin and frail, it should cross your mind, especially if you're palpating on the arms or legs and they're feeling some pain or tenderness to palpation over the bones. When you get labs on these patients, for the most part, they're all going to be normal. And that's why you need the DEXA scan. A vitamin D is going to be normal. A calcium is going to be normal. The phosphate is going to be normal. The parathyroid hormone, it should be normal. If any of these are abnormal, then you should begin entertaining differential diagnoses. So the DEXA scan, what's it do? It measures the density of the bone, and it's going to provide you a result known as a T-score. And the T-score may be negative 2.5 or more, and that's diagnostic for osteoporosis. The T-score may be between negative 1.5 to negative 2.5, and that's going to be osteopenia. So this DEXA scan and T-score, what's it doing? It's just comparing the bone density of the patient's to that of a young woman's. Again, all the blood tests should be normal. There are two types of osteoporosis. Type 1 is the type where the low estrogen in the body, it leads to bone resorption. And the type 2, that's just the type you get with age. As far as the treatment and the follow-up goes with these patients, know that they're at risk for fractures, vertebral fractures, hip fractures, distal radial fractures. Prevention is really key. And how do we prevent osteopenia? How do we prevent osteoporosis? We do this by encouraging a peak bone mass at around age 30 to be optimal. We can do that by refraining from smoking tobacco, by eating a healthy diet, and performing weight-bearing exercise. Bone health can also be supplemented, arguably, with calcium and vitamin D. Once the patient unfortunately has osteoporosis, there are a few choices. Bisphosphonates is one of them. This inhibits the osteoclast activity. Just know that one of the side effects can be osteonecrosis of the jaw. It is rare. Another choice can be a selective estrogen receptor modulator. And finally, do not give glucocorticoids to these patients.